Hello, my name is Marcia Faustin, and I'm a family and sports medicine physician at the University of California, Davis. I work under the Department of Physical Medicine and Rehabilitation, along with the Family and Community Medicine. I'm the co-head team physician for the ucdavis Division I Intercollegiate Athletics, and also the co-head team physician for the USA Gymnastics Women's National Team. Thank you to the Office of Wellness Education for inviting me here today to discuss with you healthy living, channeling your inner athlete. I have no disclosures today, although I did have the pleasure and opportunity to go to the Tokyo Olympics with these amazing women, and we'll also get to go to the Paris Olympics. My objectives today are to discuss how channeling your inner athlete will lead to strength and longevity, how training for the sport of life is so important, and that food is medicine. Lastly, we'll talk about the mindset, the ways to stay motivated and to get in the zone, as the athletes say. So we know many of the elite athletes, from Michael Phelps, who is the greatest swimmer and one of the greatest Olympians of all time. Recently, 1 week ago, I was at the Olympic trials for the gymnastics, and here are the 7 women that have made that team. And then there's Sha'Carri Richardson, who's a track and field 100-meter sprinter, who may be the first to beat out the Jamaicans in this upcoming Paris Olympics. Now, it seems like maybe you can't reach what these elite athletes are doing, but we want to channel our own inner elite athlete. And from the beginning, playing sports has always been fun. Whether we had to do it in PE class or after-school activities, what we knew is we just went outside and we had a lot of fun with our friends. And we sometimes start to lose that as we get into adulthood. But we want to channel that beginning because it was so much fun and it will lead to many health benefits. And then we have to choose our journey. So, as Robert Frost says, 2 roads diverged in a woods, and I took the one less traveled by, and that has made all of the difference. Sometimes choosing our healthy journey can be more difficult and a road less traveled, but it is the one that'll get us the most benefit. And what we know is exercise is medicine, and all different types of exercise, whether that's Tai Chi or whether that's doing yoga, any movement is beneficial to our health. And there are many benefits, such as it can prevent weight gain and promote weight loss. We can decrease our risk of heart disease, stroke, hypertension, high cholesterol. We can prevent the development of many different cancers, such as colon and breast cancer, and sometimes even lung and endometrial cancer. It can be preventative or even cure you if you do have type 2 diabetes, high blood pressure, or high cholesterol. It can help prevent osteoporosis, which is low bone mineral density, or when your bones become a little bit weaker and can increase the risk of them fracturing or breaking. It can reduce the risk of falling and the trajectory of cognitive decline, or how your memory is changing as we get older. It can improve our cardiovascular fitness, and one of the things that's most important in the population is to improve insomnia. And discussing mental health, exercise and depression we know is beneficial. Depression is consistently associated with low levels of physical activity. So when they looked at a study of 4,000 adults, they found that those that exercise had less depression. There's also both muscle strengthening exercises and aerobic exercises has been good to improve depression. So it doesn't matter exactly which exercise you do, the goal is to just keep moving. And we know daily exercise, for those who do have depression and are taking medicines, it can improve your depression, and it can improve your insomnia that may come with that. I like this quote where it says, "Every day for me is an uphill struggle. On the positive side, it's great for my glutes." And let's move on to anxiety, which is very prevalent in our society, especially after COVID-19 pandemic. Exercise can decrease panic attacks, social anxiety disorder, specific phobias, and agoraphobia, which could be the fear of going into a different place or situation. And sometimes we have to include going into a gym, which may be very frightening for some people. But when we can get over those fears, exercise can help and be a benefit to that. And when you are exercising and taking medicine for your anxiety, and also maybe doing some cognitive behavioral therapy or talking to a therapist, we know it can help to decrease your risk of post-traumatic stress disorder, or PTSD as you may know it, and obsessive compulsive disorder, or OCD. Now going back to the exercise and insomnia, We know that if you exercise, it can decrease how long it will take you to get to sleep, which is what we also call sleep latency, and it can decrease how much anxiety you have before you go to sleep. Because if you're already somebody that has trouble sleeping, as soon as you get to bed, you're fearful that you're not going to be able to get to sleep. And when we can decrease that anxiety, you can sleep better. It can also increase your sleep efficiency, which essentially just means how good did you sleep? Did you wake up and feel refreshed, or did you wake up multiple times throughout the night? So now when your alarm does go off, you're feeling very tired. And then it can make you feel more rested in the morning, which leads to a better day and can decrease your cardiovascular risks, such as heart disease and stroke. And for adults that are greater than 40 years old, they had a decreased use in medicines that they're using in order to help them sleep for their insomnia. And we know that, again, patients with depression and on medicine, they had improvement in their sleep if they were exercising with that. And not to get too scientific here, but the point of this is that there's many people that are on blood pressure medication in order to decrease your blood pressure. The point of that is to decrease your risk of stroke, decrease your risk of heart disease, decrease your risk of kidney disease, and many other factors. There are many studies that have shown us any exercise, whether it's cardio exercise or whether it's doing strength training, it can decrease your blood pressure, similar to how you're taking their medicines. And we know there are many people that do not like taking medicines, and this is a great way to combat that. And within my own clinic, this is something that I push heavily. The other thing they've shown is that if you start at a lower baseline level of exercise, and then you start to exercise for even 10, 15, 30 minutes, we know that you can even have a greater benefit within your health system, whether that's decreasing the need for your medicines for your chronic diseases within that, or to help your mood. So even if you're not exercising at all, don't be discouraged by this, because what we know is it will still help. Every little bit helps. And there are 3 principles for exercise. Number 1, it's to help your cardiorespiratory endurance training, which means if you yourself are trying to go to the grocery store and leave your house, sometimes that can be very taxing in order just to finish those small tasks, which may be big for you. But what we can do with exercise is we can give you that endurance. So maybe now, instead of just going to the grocery store, you can take a sidebar and go to Home Goods or go to Ross, like my mom likes to do. It's also good for helping your large muscle groups so that you can stay strong and also decrease your risk of falls. The second principle is strength and resistance training. We want you to get stronger. We want you to, whether that's taking the groceries out and putting them into the refrigerator, that takes strength. That takes strength to carry the milk or heavier objects. And we want you to get stronger in this because, again, that will decrease your risk of falls and it'll decrease your risk of injuries. And the third part is to get you nice and flexible, which we will go into a little bit further in detail. And the goal for exercise is to get about 150 minutes a week of moderate exercise, or if it's higher intensity exercise, that's about 75 minutes a week. So the way we usually put it for the patients is that 150 minutes a week is about 5 days a week that you're doing 30 minutes. Now again, going back to the previous statement that I said, if you're not doing any exercise right now, that's okay. You start slow, whether it's even 10 minutes every other day, that will help you start working towards this goal of what is actually feasible for yourself. The goal is just consistency. And people ask about exercise intensity. So there is an RPE scale which tells us essentially how hard are you working. So a level of 9 is very light work, such as you're taking a short walk at your own pace, whether that's going to the mailbox or going around the block or walking your dog. That's a level of about a 9. Then when we get to a level about a 13, that's where it feels somewhat a little bit more difficult. Maybe you're exerting yourself, so by the time you get home, you're a little bit more tired. When you get to level 15, it's strenuous and it can be laborious, meaning you're very tired, but you can still continue, but it's definitely a hard workout, which is, again, very individual for the level that you're starting at. And then level 17 is very hard. It's a very difficult exercise that you're doing, and you feel very tired at the end, and maybe even have difficulty finishing. And at 19, this is probably where our elite athletes are currently consistently training, is that you're working to such a hard level that perhaps you may not be able to finish that workout. Now you can see that there are many different levels of intensity, and we don't need you to get to a level of 19. We just need you to get to that level of 9 as your goal, at least at that very light level where you start to move that body. And here's our road that we're traveling. You just have to start, and there's a lot of people along the way that can help guide you into getting into your exercise routine for that. And us as your physicians, we're here to help support you in that process. And just so you know, because a lot of question that comes up in my clinic is, am I allowed to start exercising? And the 3 questions we think about on the physician side is, 1, are you currently exercising? Where are you starting from? And just to be honest with your physician about where you really are, because from there we can slowly add on the exercise that we need to, that's going to be best for you. 2, do you as the patient have any high-risk conditions? Do you have any heart disease? Do you have diabetes? Do you have any cancers? Anything else that may be affecting your ability to exercise? And what we don't do is we don't say you can't exercise at all, but we work with you, and whether that may be your specialist, to say how much exercise is safest for you. And number 3, at what intensity do you want to exercise at? That's your own personal goal of what you want to get to. We can't make those goals for you, but you're thinking about what is it that you're trying to get to. Whether it's my patient that I recently had, that his goal was to dance at his granddaughter's quinceañera, and so we worked towards that goal for a few months. Or if it's my other patient that's working towards a triathlon and setting those goals up in order for them to be what makes you best at your quality of life. And to go back to osteoporosis, the key is prevention. What we're telling you is we want your bones to be nice and strong, and that process starts at a very young age and goes into adolescence, and you make most of your bone by about 20 years old. That's why it's important for you to pass on this information about the importance of exercise, because we want you to have as much bone density and strong bone as you can, so that when you get older and later in life, if you do accidentally have a fall, you can decrease your risk of fracturing a hip or fracturing your back. And the key to this is to do exercising. And so there's a lot of people, for example, that like to swim for exercise, which is excellent. But you also want to do exercise in which, whether you're walking or you're running or you're doing an elliptical exercise, where you're putting weight on your body, because that's what helps you to stimulate your bones to grow. So let's talk about maintaining your mobility and your healthy joints as we're getting older. So what is mobility? It's the ability to easily and safely get around and do the things that you want to do. And it's all forms of movement, whether that's walking, whether it's going from your bed over to the bathroom, whether it's driving, and then whether you are doing a big amount of exercise. And why does our mobility decrease as we get older? We change how we're walking. We have a decreased sense of balance, and then we do lose strength as we get older, which is why we have to continually be working to get stronger. And some risk factors for having poor mobility is if you've been hospitalized, even if they say 1 day in the hospital, it may take you 2 days to recover. And I'm talking about maybe one of our collegiate athletes who's in the top shape. They also will need that much time in order to recover. And so if you don't have that much endurance behind you, it may take you a little bit longer. And that's okay, just remembering to stay patient with yourself. If you have a history of falls, that can be harder for your mobility. If you have any movement disorders, such as Parkinson's disease or neuropathy, and then if you have a sedentary lifestyle, where you're maybe not moving as much or spending a lot of time sitting down, this can decrease your mobility. And we're not just seeing this in the older population, especially through the COVID-19 pandemic, even for our younger kids, even those in middle school, junior high, high school, they were sitting much more because they're no longer going to school. They're no longer walking in between classes. And what's happening is I was seeing them for back pain, or they were getting very sore. They were having difficulty training. And so this applies to everybody. The goal is for everyone to continue to move. Other risk factors associated with poor mobility is increasing your risk of fall. You may isolate yourself socially. You may have to go into a nursing home or have a decreased quality of life. And quality of life is not what we as the physicians think your quality of life should be. Quality of life is what makes you happy, what makes your soul smile, and what makes you achieve the goals that you want that will change as you change throughout life. And then for different diseases, so whether you're having obesity, diabetes, cardiovascular disease, cancer, and then for your mental health, whether that may be depression or anxiety, or you have a cognitive decline, which we know our memory decreases as we get older, and that's a normal part of the process. And there are parts of that that can become a disease in which it falls a little bit faster than it should be. And then we have increased risk of disability, and then being hospitalized. The goal is always, how do we keep you out of the hospital? But the benefits of optimal mobility and movement is that you have a better psychosocial well-being, which means you just have people around you that you enjoy doing things with and connecting with. You have a decreased risk of osteoporosis, so low bone mineral density, which then decreases your risk of fractures or breaking your bones. Your cardiovascular health, so your heart health, your brain health, those all increase. Your quality of life is better, and you become more functionally independent, which what that means is you get to do what you want on your own, whether that's living on your own, whether that's cooking your own meals, driving yourself to appointments, doing those things so that you're not relying on others. And for patients that are 65 years old and older, we know about 30% of those have difficulty only walking 3 blocks or so. So going back to making those goals about what you want to do, 3 blocks could be a great goal for you to make sure that you're able to do that so you can overcome this statistics. About 20% of patients don't drive, which is a really big barrier of independence that people have difficulty with. And then we have falls and car accidents become the leading cause of accidental deaths during this time period. Again, we want to decrease those risks of falls, which is why we're always pushing to get you moving. And so the recommendation for exercise goes back to those 150 minutes per week of moderate exercise or 75 minutes of vigorous exercise. I'm going back to, though, those 3 blocks. If that is your goal, that is a beautiful goal for you to continue to work to strive towards. And you also want to do some strength training a couple days a week. There are many different programs and apps and YouTube videos that have come out, especially during the COVID-19 pandemic, that you can use to follow. And then you also want to be working on your balance to increase your mobility and decrease your risk of falling. And then going back to our cardiovascular or aerobic training, that's the brisk walking. 3 blocks, 5 blocks, 15 minutes, an hour outside. You could be doing water aerobics, dancing, hiking on a trail, riding a bike, outdoor yard work, doing your gardening work, even doing jumping jacks. So the key is find what you enjoy doing so that you will continue to do it over and over throughout time. And then for strength training, you can do weights, you can do bands, sometimes body weight exercises, push-ups on the ground, or it could be push-ups against the wall. You can do sit-ups. You can do yoga poses, or if what's difficult for you is sitting in a chair and then standing up and going to the next room. That can be a goal of working on sitting from a chair and doing those repetitions over and over again so that you will get stronger. And then making sure we're stretching. We have to say this a lot for our adolescent kids that are going through their puberty and growing because they can get a lot of injuries from this, but also in that adult range. You want to make sure you're stretching your ankles, your hips, your shoulders, your back. All of those things will help with your mobility. And then your balance and coordination, whether that might be standing on one foot at a time, walking backwards, being able to walk heel to toe, or even just walking on your heels themselves, or walking on your toes. One of the exercises a lot of my patients really love is doing Tai Chi. And there's many different programs around the Sacramento area that really helps to decrease anxiety and depression and to help improve your balance. And some reasons that you would want to stop and see your doctor, which is also a very common question I get, is 1, if you want to know, am I safe to exercise? Always make that appointment with your doctor, and it always doesn't have to be in person. You can make a telehealth appointment or a video visit with them so that we can get those questions answered for you. And then if you're having any of these symptoms, such as chest pain, difficulty breathing, you're feeling dizzy, you're feeling like your heart is racing, or you just think, is this normal? Then you should always reach out to your nurse and your doctor so we can discuss it with you. And then if you do get joint or muscle pain, which undoubtedly will come when you start new exercises, but if it lasts for longer than a week or is become so severe that you can't do your daily activities, please contact your doctor because we want to make sure we can get you as healthy as possible. And I'd be remiss to not talk about social determinants of health, which essentially means what is your life like around you and what resources do you have accessible to you. And some just have a lower socioeconomic status because of many different reasons, and we have to take this into account because it's not that easy to just join a gym, which may cost about $500 a month, or wear your Apple Watch or other activity trackers, which can be from $30 to $600, $1,000. The annual cost for youth to participate in sports is about $700. And what we found, especially during the pandemic, was that a lot of those after-school activities that were canceled during that time, it took away the ability for kids to actually go and exercise, especially in a safe position or a safe location because of where they're living. And we have to take that into account. And some of the most commonly cited reasons why people aren't able to exercise is a lack of time. Everyone is very busy. We live in a world that is constantly moving, as if you haven't done enough, despite the many things you've accomplished in the day. But what I say is always just schedule it in. Start with 10 or 15 minutes, and then you commit to that time period. You have a lot of caregiving duties, whether it's for children or whether it's for adults. And I think caregiving is maybe the hardest job we can do in the world. And so that is a real barrier to this. But also remembering that you want to care for yourself so you can be as healthy as possible to continue to care for those around you. And then there can be just a lack of motivation. It's difficult to get started. And I usually think the first 2 weeks is usually the hardest time. And after you make something a habit for about 2 weeks, it becomes a little bit easier. And then a lack of energy. Many people are working not just one job, maybe 2 or 3 jobs a day, along with all the other obligations they have. It is difficult to find that energy and to find that time. But we know exercise releases really good hormones in your brain that will help to increase your energy. And there's also concern that doing too much physical activity may make you more tired, or it's just hard work. But everyone has done hard work, and you can do hard things. Moving on to nutrition, what this says is let food be thy medicine, and medicine be thy food. And what I wrote up here is the 80-20 rule, because this is what I personally follow, and then this is what I try to get my patients to follow. 80% of the time, we're trying to do the right thing, right? You're trying to eat healthy, which is fruits, vegetables, avoiding fried foods. You try to keep it very basic. But 20% of the time, you get to live your life. I love French fries, so I eat them 20% of the time, especially when I'm more stressed. And that's okay, because we can't be perfect. It's not possible. And what the American Heart Association and Cardiovascular Health has said is that food is medicine. Food is the center of everything that we're doing here. And if we can eat healthy in that way, then we can decrease our risk of those diseases, such as the cancers, the heart attacks, the strokes, so that we can live a healthier life. But we also, again, going back to those social determinants of health, recognize that healthy food is not accessible to everybody. There are food deserts, and wherever you're living, you may not have that access. But that is an opportunity for you to go and speak to your doctor. There are many different resources, such as social workers or case managers in the clinics, that can help you think outside of the box of how can we get this healthy food for you, along with our nutritionists. And the third part of this is the motivation. We've all had that experience where we know we should be doing something and you just can't get yourself to do it. And that's okay. We're just human, as long as we can work towards breaking that cycle. So one of those mnemonics is the SMART, which is when you're setting goals, they should be specific. What exactly do you want to do? They should be measurable. You should be able to have a time point and say, did I hit that or not? They should be achievable. Such as for myself, I can't say that I'm going to be an Olympian. That is never going to be achievable. But I can say that I can train to do another race for myself. It should be relevant to yourself, right? You have to set your own goals. Us as physicians cannot be setting your goals for you. Your family, your friends around you cannot, because in the end, you're going to lose that motivation. And it should be time-based. You should have an endpoint of where you're going to check in with yourself. So an example of this is, for my patients, I say, how many days a week do you want to start exercising? They can say, I want to start exercising 3 days a week. Often, actually, what patients say is they'll say, I want to exercise 5 or 6 days a week for an hour each time, but they haven't exercised at all. So I bring them back and say, that is not feasible, or it may be feasible, but it'll be a lot of hard work, and it's really disappointing to not be able to hit your goals, and you'd lose that motivation. So let's make it small. Exercise 3 days a week, maybe 15 minutes each time. The way it could be measurable is that you can work out with a friend and you can have that accountability partner. You know you've exercised before, and so you're able to do this again. And what is your ultimate goal? Your goal is to dance at your daughter's wedding. And then we can reassess this in about 6 weeks. And I know for some people, they say, well, I can't get into my doctor for another 3 or 4 months, and we know it's a problem. But something you can do, and something I do with my patients, is I have them send me a message in about a month. Because going 3 months without touching base on what those goals are, you may lose motivation in that time period. Whereas those small markers, like every 4 to 6 weeks, that's a good time to reassess how you're doing, where you're at, and do your goals need to change? And some ideas to increase your physical activity. One, we discussed joining a gym or joining a workout group. For those that have Medicare insurance, Silver Sneakers is a great program that covers your ability to exercise. You can get personal trainers, something that's in that daily routine when you just don't have the time or the energy. Parking further away, get extra steps in. Taking the stairs instead of the elevator or that escalator, and maybe standing at work instead of sitting constantly. The other thing I like to have my patients do is set a timer every hour to go off on your phone or on your watch so that you stand up, take a lap around the office, even if it's 30 seconds, and then sit back down. And then for the kids and the teenagers, the adolescents, the screen time, I guess I shouldn't even say them. Also for us adults, that screen time takes away so much time for us to be doing other activities. We spend a lot of time on social media, and that's the way that it's created. But really trying to break those habits and setting those goals of limits of how much you're going to be on the screen, and then making sure you accomplish your physical activity for that day before you do get on your screen. And then sometimes looking for other adults, looking for services that may be at skilled nursing facilities or extended care facilities, where you can make sure that you're incorporating some type of physical activity. And like one of my favorite Peloton riders, Kendall Toole, says, is that they can knock you down, but never let them knock you out. So make sure you stay in the fight. You will fall down. We all have done it. And you just fall off for a little bit, and that's okay. Slowly get back on that train and know that it's never going to be a straight line. And that's part of the beauty and the journey of life. So some take-home points. We are all athletes, and any movement is movement. Food is your fuel, but we understand that there's barriers to getting that appropriate food that you need. So making sure you're reaching out to your physicians, your nutritionists, your healthcare providers, so we can help you find those resources. And having a positive and a realistic mindset. Set your goals, make them baby steps, and then slowly but surely you'll work towards those bigger steps. And I think one of the most important keys is get yourself an accountability partner or a training partner. It will help you stay on track with what you want to do. And then as humans, we have to accept setbacks. Get back in the game. Don't give up on yourself. And then make sure you're just having fun, just like when we first started playing sports when we were kids. Enjoy what you're doing and find the things that make you happy. Pictured here are my colleagues at the ucdavis C Street Sports Medicine Clinic, and together we all work together to make sure that our patients are moving and to help keep them motivated. Thank you for having me here today.